So the World Health Organization has named a new variant of COVID-19 detected in South Africa, Omicron. It's actually the 15th letter of the Greek alphabet. There are growing concerns that Omicron will hasten the fourth wave of infections in this country. The United Kingdom and several other nations have since placed travel bans on South Africa, while scientists are said to be grappling with this variant and the COVID-19 vaccine's efficacy against it. President Cyril Ramaphosa will today be meeting with the National Coronavirus Command Council to discuss this development and its implications. We want to know, are we likely to see a more heavily restricted festive season? Let's answer some of these questions and plenty others. Bring in our guest, founder of Alchemy Health Technologies, and as well as a health policy advisor, Dr. Ntuthuko Bhengu, who joins us now via our video link. And Doc, it's great to see you. Thank you so much, as always, for making time to chat to us here on Newzroom Afrika. Perhaps let me begin with what's top of mind for many people who are hoping for a whole lot more movement come December. This decision by various countries, a growing list of countries, to impose travel restrictions on South Africa. Is it premature or is it them being proactive? What's your take?
Good morning, Ayanda. Good morning to viewers of Newzroom Afrika. Yeah, thank you very much. I think the point about this is that one has to go back to principles in terms of how pandemics or highly transmissible infections like this should be managed. So on the one end, it's a question of governments having to balance what scientists advise and what, for example, also considerations like social issues, like economic issues. And if you were to ask scientists, they probably will say lockdown, but maybe the opposite answer coming from the other parties. So the point about this is that there is so much that's still up in the air. What we know is that the virus this variant is highly transmissible, but it hasn't been determined whether this leads to more severe disease, more frequent hospitalizations or more deaths. And of course, the bigger question is whether vaccines will be protective. So, look, the point is that it's a difficult space for now, but the reality is that a lot of this is in our hands from the perspective of managing the non-pharmaceutical interventions. So it's really difficult because all governments take advice from their scientists and also do their own considerations. Yeah. And of course, we now know that in South Africa we're doing that tonight, at least.
For better or for worse, Doc, we've been here before. We've had a situation where we were dealing with a variant we didn't really understand and weren't quite sure what to do moving forward. I wonder whether hindsight is the best advisor here. What do we know about the effectiveness of a lockdown? Because there are people who've come out to say that at best, a lockdown will buy you time. At worst, it'll completely decimate your economy. However, lockdowns don't prevent a virus from spreading, ultimately at least.
That is true, but it must be said that they don't do that precisely because we don't seem to want to cooperate. Because if you do get a reduction of mobility of movements and physical distancing, they would work. But it's a question of to the extent to which we are disciplined to see that. And you are right in that they haven't worked, but that's simply because we haven't complied as a nation. And maybe that's where the message is, because if one looks at how to deal with this, it's prevention. It's the non-pharmaceutical interventions, which include physical distancing. And of course, we do have vaccines. We continue to choose not to use even though we have them. Now, what government is facing now and what we are looking at is if they were to go with lockdown, it's actually enforcement of what we should be doing ourselves, which is physical distancing. But I suspect that the issue of mandates, which on its own is really more, again, enforcement of what we should be doing to be going for vaccination. I suspect South Africa can no longer avoid the question of vaccine mandates, whether one thinks that's good or bad. And if government doesn't do it, I just think a lot more of corporate will take leadership on their own. We've actually seen that. We've heard that. I just think Omicron will give more impetus to the move towards mandates at various levels.
Yeah. In fact, we've seen Wits University being the latest institution to follow that path after the University of Cape Town and Discovery. Those are just the two other prominent institutions that I can think of at the moment. Shall we speak about Omicron with a bit more detail, Doc, if we can? I mean, scientifically, we've heard that there's a lot we don't know, but interestingly, the detail that's grabbing a lot of headlines is this issue around mutations. It's got upwards of 30-odd mutations. Help us place what that actually means in layman's terms, and whether or not, there's anything ordinary people can do about that kind of information.
Yeah, thank you very much. What we know about Omicron is that it features more than 30 mutations or changes specifically to the spike protein. Spike protein is the part of the virus that is actually the lead in terms of attachment to the human cell. Now, what it means is that there are more than 30 changes, and this has been described as never really been experienced before. Now, it bears noting that viruses, by their nature, they do mutate. It's just that some of them those mutations aren't consequential, but others do, which is why the WHO will then sort of follow and classify if it's a virus of interest or a virus of concern. And Omicron has been identified or designated as a virus of concern. Now, what it means is that potentially, if there are changes to the spike protein, you will recall that the original vaccines were manufactured, developed and manufactured to the characteristics of the virus. Now, what this could potentially mean, I stress that potentially, is that if these mutations are significant, on the question of protection, it means that the antibodies, if you had been exposed already, your antibodies might not necessarily have the neutralizing effect that they could. But the question is, for example, would vaccines fall on the would vaccine also suffer the same fate of either being less effective or worst case scenario ineffective at all? The point is that we don't have an answer to that. What I have read from Nature Journal, they cited a Wits professor that we are actually looking at 2 weeks as to whether or not the protective effect of antibodies would be somehow diminished. I suppose that's the whole point when people say, can't we just wait for more to come out before we can actually start making policy decisions?
And that's exactly where I was hoping to go with you, Prof. Apologies there if I cut you off. As a health policy advisor, typically how do you balance these two things? On the one hand, we're working in an environment where there's great uncertainty, and so making any decision is actually difficult to justify. But on the other hand, inaction could be the worst thing to do as well. You spent a whole lot more time, I imagine, tussling with this apparent tug of war in your own work. So typically, how do you solve this kind of quagmire in any context, even outside of something like a COVID-19 pandemic?
Yeah, the point is that being conservative would be the way to go, but that's only if you are looking from the prism of scientists. But we hear again, which is also true, that there is the question of livelihoods. We've lived with the virus, we've learned to make adjustments, and we have to look at ourselves. With all the knowledge that's there, we still choose not to follow the prescriptions that would help. Now, this is what I think is the difficulty. If the decision makers knew that we would comply, are highly vaccinated, it would be a much easier decision in my view. But look, at the end of the day, why it's difficult to make a prediction? Because I'm quite certain what the scientists would suggest. But governments don't, but scientists don't rule countries. Governments do, and they are obliged to take so much more into account than what scientists want. So the issue of the economy and social issues are critical. And it will come down to the balance of argument from each of the parties. But we do hope that there will be, there's no clear-cut, easy solution here. That's the point, and it's hard for me to try and second guess regarding lockdown, but I'm willing to bet that, as I said, the issue of vaccine mandates is what is more likely to be an outcome of discussions, whether formal through government or through other leaders of society like industry taking lead on the matter.
Right. I imagine, despite the many disagreements, one thing is for sure, many people will agree that those on the Coronavirus Command Council have an unenviable job over the next couple of hours. For now, let me thank you for your time. Really do appreciate your insights. Dr. Ntuthuko Bhengu is the founder of Alchemy Health Technologies and is also a health policy advisor. Once again, thanks very much indeed.